Can you trust ChatGPT for medical advice? Let's find out. In this episode, we are looking at plastic surgery. What is plastic surgery? ChatGPT says plastic surgery is a medical specialty focused on reconstructing or altering the human body, correct? It can be broadly divided into two categories: reconstructive surgery and cosmetic surgery. Very correct. Reconstructive surgery aims to restore the form and function of the body after injuries, trauma, or medical conditions like cancer or congenital deformities. For example, it includes surgeries to repair burn damage, reconstruct breasts after mastectomy, or correct cleft palates. Cosmetic surgery focuses on enhancing a change or changing a person's appearance according to their desires. This includes procedures like facelift, rhinoplasty, nose job, breast augmentation, liposuction, and tummy tucks. While cosmetic surgery isn't typically medically necessary, it can have a positive impact on a person's self-esteem and quality of life. Overall, plastic surgery involves various techniques and is often performed to improve both physical function and aesthetics. I am impressed. This is a very nice and concise summary of what actually plastic surgery is. We broadly divide plastic surgery into these two categories only. These categories are further divided into a lot of more subspecialties. Like reconstructive surgery can have hand surgery, brachial plexus surgery, lymphedema surgery, microsurgery. Cosmetic surgery can have facial cosmetic surgery, body contouring, liposuction, non-surgical facial rejuvenation, and a lot more. But overall, broadly, these are the two categories that plastic surgery handles, and this summary is almost correct. Now I've asked ChatGPT, can plastic surgery change face? It says, yes, plastic surgery can change a person's face, and there are several procedures designed specifically to alter facial features. They can be done for cosmetic reasons or to correct structural issues due to injury, congenital conditions, and medical treatments. Here are some common types of facial surgeries: rhinoplasty, facelift, blepharoplasty, chin augmentation, cheek augmentation, brow lift, jawline contouring. Plastic surgery can change facial features in subtle or dramatic ways depending on the procedure and the patient's goal. If someone is considering such surgery, it's essential to consult with a skilled and experienced surgeon to ensure the results align with their expectations and overall health. Now, I would like to correct ChatGPT a little bit here. It does not change your face, it just makes your face more beautiful. You look like the same person, just a better version of yourself. We make your nose look better, we make your eyelids and eyes look better, your brows look better, your jawline look better, your cheek look better. You will not look like another person. You will continue to look like yourself, but just a better version. Now, is plastic surgery risky? Like any surgery, plastic surgery does carry some risks. However, the level of risk largely depends on the type of procedure, patient's health, and the skill of the surgeon. Generally speaking, plastic surgery is considered safe when performed by a qualified, experienced surgeon in a proper medical setting. Still, there are potential risks to be aware of. Now, plastic surgery is a super specialty branch, and we do not handle any vital organ. So, it is not more risky than any other surgery. But yes, there are some plastic surgery specific risks which can happen. Let's see what ChatGPT says. Infection, scarring, bleeding, anesthesia risks, blood clots, poor healing complication, unsatisfactory results, nerve damage. Now, out of these 8, the first 6 are common for any surgery. Unsatisfactory results is specific to plastic surgery because you want that particular change in your body which you may not get and you might be unsatisfied. And nerve damage is because we handle delicate structures. There are some nerves running around those areas, though there is a risk of nerve damage. So this can also be specific to plastic surgery. Now, if you look at specific risks for cosmetic and reconstructive surgery, cosmetic surgery typically carries more risks for people who are in good health but are undergoing elective procedures for aesthetic reasons. Yes. If complications occur, these are often not considered medically necessary and may require additional work or corrections. So if you undergo a rhinoplasty and if there's a complication, like you are not happy with the results, they are not a medical emergency or a medical complication. It is just that you are not happy with the results. And for reconstructive surgery, on the other hand, is often done after trauma or medical conditions. And while the risks are similar, outcomes are sometimes more critical for health reasons. Yes, for reconstructive surgery, the complications can be detrimental to your health and may be considered a medical complication and has to be dealt with. And how do you minimize these risks? You must get your plastic surgery by a qualified plastic surgeon. You must follow the instructions carefully. Always ask your surgeon if you have any doubt. Communication is very important and you must understand the recovery process. Now, is plastic surgery expensive? This will be interesting because this will be mainly from the US, and in India the rates may vary. Plastic surgery can be expensive, but the cost varies depending on various factors like type of procedure, surgeon's expertise, hospital or clinic fees, anesthesia and medical equipment, and post-operative care. So yes, some procedures like rhinoplasty, facelifts, breast surgeries are expensive. Experienced surgeons will obviously charge more. Hospitals like corporate hospitals, five-star hospitals will charge more. Local anesthesia is generally cheaper, general anesthesia is costlier. And post-operative care, you might need some basic medications, some splints, some garments. That's all. You will have to pay for those things. But overall, I won't say plastic surgery is too expensive. Yes, if you go to topmost centers who treat celebrities and models and all, they will be expensive for sure. Otherwise, plastic surgery rates are almost like any other super specialty. Now, some people ask, is plastic surgery permanent? Plastic surgery results can be long lasting or permanent. It depends on the type of procedure, individuals' factors, and lifestyle choices. Some procedures are permanent, like rhinoplasty, breast augmentation, liposuction, and facelifts, while some procedures are non permanent and maintenance dependent, like Botox and fillers, fat grafting, and thread lifts. So, if you see, ChatGPT is giving you most of the advice that plastic surgeons give. So the importance of consultations these days in the times of ChatGPT is slightly lower, especially for surgical branches. You can get the basic information on ChatGPT and internet. So if you have access to ChatGPT for plastic surgery information, I think you can trust it. It is giving you legitimate information. It is giving you the correct information. Yes, it is not perfect, but for plastic surgery information, you can trust ChatGPT. Like if you see, for liposuction, fat cells removed don't come back. Absolutely correct. But new fat can accumulate if diet and exercise are not maintained. This is exactly what we tell to our patients. Rhinoplasty. The structure of the nose is permanently changed, but natural aging may cause subtle shifts. Absolutely on point. Facelift provides a younger look for years, but aging continues naturally. Again, right on point. Botox and fillers are temporary. Botox lasts for 3 to 6 months. Fillers last for 6 to 18 months. Fat grafting. Some of the transferred fat may be reabsorbed by the body, so results can change over time. Thread lifts are less invasive than a facelift, but last only 1 to 3 years. I feel useless after reading all this. Basically, this deletes the importance of having a consultation with a plastic surgeon. If someone is good at using ChatGPT and asking the right questions, all he is left with after all this information is to choose his surgeon. For reconstructive surgery, ChatGPT may not be that good. Let's find out. What is lymphedema surgery? Now, this is a difficult one. Let's see. Now, what you read here is a little technical. You may not understand all of it. ChatGPT will try to explain it to you, but this is very complex. Lymphedema surgery, it's dividing lymphedema surgery into various types: lymphatic bypass, lymphovenous anastomosis, vascularized lymph node transfer, VLNT, liposuction, debulking surgery. So reconstructive surgery is a little complex. You may not get the right information for reconstructive surgery on ChatGPT. For cosmetic surgery, whatever you need to know is available. What is free fibula flap? A free fibula flap is a type of vascularized bone graft used in reconstructive surgery to repair or replace missing bone, usually in the face, jaw, or limbs. Key feature: vascularized bone transfer, versatile use, minimal functional loss. Common uses: mandibular reconstruction, limb reconstruction, skull or facial bone defects. Surgical process: it is explaining you how we do it as well. A segment of fibula is harvested along with artery and veins. Bone with or without attached skin or muscle is shaped to match the defect. Microsurgical anastomosis is performed to restore the donor side is closed, often without major functional issues. Provides strong vascularized bone for long-term survival. Can be shaped to match complex defects. Allows for dental implant placement in jaw reconstruction. Has minimal impact on leg function. Now, it may be a little confusing because reconstructive surgery is an advanced surgery. You may not understand it at first go. So I will always say, for reconstructive surgery, don't really trust ChatGPT. Trust the surgeon, what he says. Alright, that's all for this plastic surgery episode. If you like the episode, do comment and share your views. We'll come back with another topic in this series very soon. Namaste.